Well, good afternoon and welcome everyone. Happy Friday Eve. And like to invite everybody and welcome folks to the fourth meeting of the Legislative and External Affairs Advisory Committee. Now we will take roll in order to establish quorum, but please note that under Bagley-Keene Open Meetings Act, any commissioners, such as myself, who are participating remotely, must keep their camera on at all times and will be asked during roll call to disclose if they have any other adults over the age of 18 in the room with them during the meeting and the nature of their relationship with those individuals. Krisangi, please take roll.
Commissioner Fairweather.
Here and no, just an 8-year-old cat.
Commissioner Hill. Noting absent. Commissioner Larson.
Present.
Commissioner Mitchell. Present. Commissioner Southard.
Present and alone.
Commissioner Thomas Beckett. Noting absent. Committee Vice Chair Callan.
Present.
Committee Chair Bontrager.
I am present and alone.
6 people in total. We have quorum.
All right. Thank you, Krisangi. We're now moving on to agenda item 2, announcements, and we'll start with committee updates. As part of our ongoing commitment to transparency and collaboration, we want to ensure that information flows seamlessly across all Commission on Behavioral Health committees. To support this effort, we will take a moment to review key updates from the other 4 committees. By sharing these updates, our goal is to keep everyone aligned, streamline communication, and foster a more connected approach to our work. I see that we have the highlights up on the screen. The Budget and Fiscal Advisory Committee received a presentation on the 2025-26 mid-year budget update, as well as a presentation on the 25-26 spending allocations, giving an overview of financial priorities and planning for the upcoming year. The Program Advisory Committee received a presentation from DHCS on performance measures for the Behavioral Health Services Act, and also heard a presentation by staff on its data framework, thus highlighting efforts to align and improve data-driven decision-making. The Legislative and External Affairs Advisory Committee, this very committee, will meet and consider bills that the Commission may choose to support or oppose in the 2026 legislative session. We also provided an update on the Early Psychosis Intervention EPI video project, which focuses on promoting coordinated specialty care for EPI. Finally, on February 24th, the Workplace Optimization Advisory Committee will hold a closed session and hear from Human Resources regarding workplace wellness matters. And on February 26th, the Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee will have a focused discussion about the future structure of the committee, exploring ways to strengthen inclusion and representation moving forward. They will also have a discussion on the effects of the Behavioral Health Services Act implementation on peer-run organizations and peer services. And with that, I'm going to hand the remainder of the announcements over to my very capable Vice Chair Callan.
Thank you, Chair. I'm excited to announce that Assemblymember Berman, who's going to author our sponsored bill on suicide prevention. Assemblymember Berman championed the previous pilot version of this bill, and we're grateful to his dedication to seeing this effort through. This bill was introduced on February 17th and was assigned bill number AB 2003. We will provide more updates as this progresses. Now, in line with our new transparency efforts, we will begin providing brief updates on recent contracts and amendments during all committee announcements for informational purposes only. Please note that contracts are negotiated between the Commission and the contractor and must be mutually agreed upon. This month, we have one contract for translation of the BHSA toolkit into threshold languages for up to $30,000. Please bring up the contract slide. Okay, the slide is on the screen. All right, lastly, our next full commission meeting is March 26, 2026 in Sacramento. For more information on any of these items, please visit our website and sign up for our email distribution list. I'll pass it back over to the chair.
All right. Thank you, Vice Chair Callan. That concludes our announcements for this meeting. I again want to welcome everyone. It is time for agenda item 3, general public comment. This time is reserved for comments on items that are not on our agenda. Mariani, please lead us into public comment.
Thank you, Chair. If you'd like a live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair so that we can be mindful. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. We currently have one virtual comment from Steve. You could go ahead.
Can you hear me okay?
We can
We
hear
can.
you.
Great. Thank you very much. Hi, my name is Steve McNally, and I'm a community member, a father of an adult son with schizophrenia. All his relationships with his family have been um, reconnected, and uh, and I'm also on a local community board with Welfare and Institution Code Responsibilities 5604.2, which I would ask each of the new members to look at it and the old members or continuing members to be more aware of it. Uh, I'm going to ask for a couple things today. One is the way I see this is the most influential group is your group. Uh, and with the new members, it has become more of a working group and more of a publicly sharing opinions and stuff, and I appreciate that. The second group is the Behavioral Planning Council, which is 40 people, including 33 community members and 7 state agencies, which give you an open door to the state agencies. That's quarterly. And then there's the local boards and commissions, which is 900 plus. The big benefit is they give you access to 59 electeds at the supervisor level, unless it's a city like Berkeley. Those particular electeds, the supervisors, do not really receive any unfiltered communication because they're not on any distribution list that I'm aware of. So I would ask that maybe, and I've asked this a lot before, is to figure out how we can coordinate the 3 groups. Maybe it's a 2-page frequently asked questions or something which we can put the 3 of us on the page, or we invite your members that live in, I don't think we have anybody in Orange County, but uh, like LA could come and talk to the LA board. Uh, and that way it would give it a little bit more credibility at the local level. It gets very dismissive at the local level. And that's why I think you'll see a lot of things get raised up to the state level because we things become chronic when you say them over and over again. And nobody says, well, we can't do that today. We'd love to do that, but we'll move. And then you just would stop bringing it up and then you go on to a new topic. So I guess the combination of your influence and then allowing us to localize uh, and improve the local boards would be helpful for my family and my son. I speak as an individual, I'm not speaking for my board. And the last thing is LA, Orange County, Riverside, San Bernardino are 45% of California. They're 45% of the Medi-Cal. They're 40% of the 5% of the population, the legislators, the business of the hospitals. So there's a real opportunity when you have a message to get out or Narcan distribution or communities. If LA will go along, then these 3 smaller counties can get access to TV and radio, and it's one big media market. So again, thank you for letting me. Oh, one last thing. I'm sorry, and I wasn't paying attention to time, but I'm sure it's got to be up soon. Uh, I don't know if this is because I didn't see a matrix in the notes, but I'm very concerned about this AB 96 that got gutted. which was going to allow certified peers, of which we have about 9,000 of them, but it's not clear if they're working or not, uh, to be considered community health workers, which would allow them to bill in managed healthcare. So the state continues to try to get rid of the carve out. We're going to have certified peers have no place to get bill. So, and also it's been very difficult, at least for me, maybe not for others, is to figure out how we're going to use those 9,000 peers to increase the federal funds participation rate funding, which is one of the whole reasons for some of these unlicensed jobs. So uh, maybe in your sphere of influence, you can ask people who can answer those questions because we've been unable to get answers as citizens. Thank you and have a great day.
Thank you, Steve. Can a quick follow-up question? Can you recite the welfare and institution codes that you cited early on in your comments?
Yes, it's Welfare and Institution Code 5604.2,
Okay, thank
and
you.
they're the shall duties of every board, which means we must do them by law, but there's no recourse if we don't do any of them or all of them. And volunteer boards are very difficult to gain traction and get a lot of commitment. So thank you very much for asking.
Thank you.
That was our last public comment.
Well, thank you for the public comment. I do believe we're going to be speaking about AB 96 later in the agenda. So more to come. So now we'll move to agenda item 4, approval of the December 15th, 2025 Lex Advisory Committee meeting minutes. At this time, I would like to invite commissioners to offer comments or to ask questions. Okay, there appears to be none. Mariani, please go ahead with public comment.
We do not have public comment for this item.
Well, thank you, Mariani. Now that public comment has closed, I would entertain the motion that the committee approve the December 15th, 2025 meeting minutes.
So moved.
Second,
Commissioner Farrell. Great. We have a motion and a second. Are there any additional questions or comments from commissioners? All right, see no more comments. Krisangi, please call the roll.
Just confirming that Larson made the motion and who seconded?
Southard,
Okay, thank you.
I think I don't know if I think Fairweather also made a motion, so maybe Larson beat her to it.
I think we spoke at the same time.
Okay,
Fine.
all right. Okay, great.
Happens more often than you would think. I'm trying to get it our transcriptionist. Commissioner Fairweather on the on this motion.
Aye.
Aye. Commissioner Hill, absent. Commissioner Larson.
Aye.
Commissioner Mitchell. Abstain. Commissioner Southard.
aye.
Commissioner Thomas Beckett, noting absent. Committee Vice Chair Cowan
Aye.
and Committee Chair Bontrager.
Abstain.
4 total, which is still a majority for those present, so it passes.
Right. All right, we're moving quickly. Agenda item 5. Agenda item 5 focuses on upcoming 2026 legislation. The legislative session began in January and bills are still slowly being introduced. However, there are 2 bills already in print that we have been asked to support, as well as 1 budget item. The 2 bills are Assembly Bill 96 by Assemblymember Jackson regarding peer support specialist, which Kendra will be joined by the sponsor with Cal Voices and Amir Rashid with CBHDA in her presentation, and Assembly Bill 1540 by Assemblymember Mark Gonzalez regarding 988, which Kendra will be joined by the author's office, Kyle Johnson, in her presentation. Lastly, Kendra will present on the proposed budget cut to the statewide Medi-Cal mobile crisis benefit. At this time, I'd like to invite Deputy Director Kendra Zoller and her guests to kick us off.
Okay, thank you. As the chair just said, I'm Kendra Zoller, Deputy Director of Legislation and External Affairs. Before we begin, I want to explain how these 3 items were chosen for the agenda. They were prepared before the recent surge of bill introductions, as tomorrow marks the deadline for introducing new legislation. So many bills have surfaced just this week. And many more on Monday. The 3 items we are discussing today were introduced early in the process, and we were prepared for before the committee's deadline for these materials. So this should not be interpreted as an exhaustive examination of all the behavioral health related legislation under consideration. All of these items were brought to us by stakeholders and were put through our committee's decision-making framework before being presented here today. Okay, so we'll begin with Assembly Bill 96 by Assemblymember Jackson, sponsored by Cal Voices and CBHDA. Marin Aganafer, Policy Director at Cal Voices, as well as Amir Rashid, Director of Legislative Affairs at CBHDA, will be joining us virtually to present on the bill, which is currently moving very fast through the legislature, already in the Assembly Appropriations Committee. And Marin, if you don't mind, or Amir, if you can comment on the gut and amend as heard in the public comment, that would be great. Please go ahead. We should open your mics.
Hi, good afternoon. Should I start, Amir? Okay, thank you. So, yes, the bill is no longer gives a pathway for peer support services for CHW. Good afternoon, Commissioner. My name is Meron Gonifer. I'm the Policy Director with Cal Voices, one of the oldest peer-led organization. Thank you for the chance to discuss AB 96 Jackson. First, on behalf of Cal Voices and CBHD, we would like to appreciate Assemblymember Jackson for introducing this bill. As amended, AB 96 will remove the high school requirement for certified medical peer support specialist. This would remove barriers for individuals seeking to become certified medical peer support specialist. California has established a standard medical peer support specialist certification program as outlined in SB 803. CalMesa serves as the certifying entity. The Department of Healthcare Services sets the core competencies, ethical standards, and other certification eligibility requirement for peer support specialists in 2021 and reaffirmed them in 2025 in the Behavioral Health Information Notice 25010. Peer support specialists cannot bill medical unless certified. Already, 8,447 peer support specialists throughout California have been certified in alignment with this mandate. Cal Voices YSU is a CalMesa approved training provider. Our curriculum incorporates the 17 core competencies, the Code of Ethics, which reflect the Substance Abuse and Mental Health Service Administration SAMHSA standard. To achieve certification, peer support specialists must complete an 80-hour training program provided by a CalMesa approved training entity. The certification remains valid for 2 years. To renew, they must also complete 20 hours of continuing education, including 6 hours in law and ethics. The certification standard for peer support specialists properly prepare peers to serve behavioral health consumers and bill medical. The Federal Center for Medicare and Medicaid Services recognize peer support services as an evidence-based model essential to delivering behavioral health services. Removing the high school diploma/equivalent requirement will not impact the curriculum, core competency, or ethical mandates for certified medical peer support specialists. We would greatly appreciate the Commission for Behavioral Health support for AB 96. This is important because according to the August 28, 2024 HCI report, there's a 47% statewide gap in peer support specialists in California's public behavioral health system, with an immediate need for at least 3,000 additional peer support specialists. Thank you for your unwavering support for the peer workforce, and thank you for your time. And I'll ask Amir to add to his points.
Good afternoon, everyone. Thank you so much. My name is Amr Rashid, Director of Legislative Affairs here at CBHDA, or the County Behavioral Health Directors Association of California. And we are really proud to be co-sponsoring alongside Cal Voices AB 96, which as you've heard, proposes to update current law regarding criteria necessary to be certified as a peer support specialist by removing that high school graduation requirement. Peers bring vital and irreplaceable expertise in providing outreach and developing profound trust with clients in need of mental health and substance use disorder services. And the skills necessary for effective peer support, such as communication, empathy, self-awareness, and cultural competence, are critical to connecting with our clients. The current requirement for a high school degree has inadvertently created barriers that exclude those who could excel in these roles based on their lived experiences. AB 96 embraces those individuals with important lived experience who can provide that personal connection and outreach. In addition, this change lifts up the diversity and relatability of the workforce, which is essential to addressing community behavioral health needs. Peers are part of outreach to people who are unhoused in our communities, to people experiencing crisis, to young people who need someone they trust to connect to. This workforce, especially post HR1, will continue to be an essential part of our system as it relates to this direct community outreach as Californians navigate potential losses in coverage and funding. Currently, AB 96 is awaiting referral to committee in the Senate Rules Committee. It has passed out of the Assembly with no no's votes, with bipartisan support, and enjoys the support of over 20 organizations and counties, including Sacramento and Alameda counties, all with the explicit goal of making it easier for individuals to become peer support specialists and support this critical workforce. And we look forward to your potential support here today as well.
Okay, thank you. I was going to add in how this bill fits our framework, but you pretty much covered all of my talking points. So I will just add that in line with our framework, it does fit with our existing efforts, the Commission's efforts in this space, such as our Mental Health Wellness Act Peer Respite Project, our client and consumer advocacy, and many of our approved county innovation plans for peer support. It also addresses our strategic plan's goal to champion vision into action through our system improvements and catalyzing best practices like workforce strengthening. And of course, it supports the Commission's vision of a more effective, accessible, and recovery-focused system for all Californians. And the stakeholder support is very robust already. We could take questions on this one now, or we could keep going and do questions at the end. I know our staffer on the next bill is joined, so I'll leave that up to Chair, Vice Chair, Committee.
Well, I have some questions, so I would hope we could entertain a few right now, and that is, can you describe what's happened to the bill, and the gutting of it, and just can you provide a little bit more about that?
So
Yeah.
initially,
Go ahead.
oh,
Go ahead. You go first.
go ahead, Kendra.
No, please do. It's your bill, so I'll give you the mic.
So initially, the idea was to expand the community health workers definition to give peer support specialists the certificate pathway. We encountered some opposition, and so we pivoted.
Yeah, thank you. Understand that. Can we peel back the onion a bit? What's the opposition or the stated reason for the opposition?
The opposition really has not come out to express their, have not really articulate and, officially their opposition, but they felt that the two workforce are distinct and separate, and they felt it should not sort of merged.
So I have a question too. Currently, does a GED count as a high school degree?
Yes.
Okay.
I have a question too. Is the age requirement 18?
Yes. So currently with the Welfare and Health Code 1404.15, all the requirements are maintained except the possess a high school diploma or equivalent. The rest of requirements are intact.
Which is what CHWs have now. Yeah.
And if any fellow commissioner has questions, please, I can't see everybody, so please just speak up. I have a follow-up question, however, and that is, I am the Medi-Cal Managed Care Plan representative on the commission, so this impacts our provider network when peer supports only exist in the county network and not managed care. This doesn't preclude peer support specialists from undergoing the CHW pathway, correct? It just doesn't provide an automated pathway. Is that correct understanding?
It's correct.
Okay. Okay. I still am at a loss around the opposition, but okay.
I don't want to relitigate that for a political reason, but I
Okay.
understand, Commissioner.
Okay. Are there any other commissioner comments as it relates to AB 96?
This is Commissioner Mitchell. I'm just curious, does the bill, since I have not read it, does it include any of the specialist classifications for the peers, such as like for the, is there like SUD specialization or housing specialist
This
or?
is exclusively for the medical peer support specialist as it relate to WIC code 1404.15.
Okay. So it's no other okay.
It's only exclusively. Thank you for your question.
Mm-hmm.
How many potential candidates do you think there are without a high school degree or equivalent?
Sorry about that. So I don't have that number or data because CalMesa does not really record those information. We had done our own internal survey within our local partners, and also we are, we have a certified peer support training center. And so there are individuals who have been unable to take classes as a result of this requirement, and removing this, it's important. But I don't have the precise number, but certainly is an issue and a concern. And if you take a look at really the most important qualification for this is to be self-identified as having experience with the process of recovery from mental illness or substance use disorder, either as a consumer of the service or as a parent, caregiver, or family member. This is critical. So overall, the foundational principle of this as applied is discussing recovery-oriented, person-centered, and relationship-focused. So high school, criteria, it's not relevant.
I think if I could just add to the number piece, I think because so many and of the because it's so essential that this part of the workforce has that lived experience, I think one can imagine just how many of those experiences took place during those high school years, right? Which could have impeded the completion of that high school degree, for example. And so I think, I think those are things to take into consideration as well of who we could potentially be leaving out that could be really critical support for our system.
Yeah, the only reason I was asking the question is my son has lived experience through high school, crashed in high school, but got a GED, and the attainment of a GED allowed other paths to open for him that would not have been otherwise. So I'm just thinking of the welfare of these individuals, not trying to create an obstacle.
I have a question following up on the specific type of peers. This is medical peer. So for other peers who are working in SUD or housing or other areas, they do they have to have a GED?
So the main criteria for all specialty,
Oh, okay.
it's a medical peer support specialist. It's
Mhm.
outlined under the code 14045.5.
Okay.
And I think generally speaking, for all of that peer support specialist requirement across the board, it lists this as a requirement. And so we're just going in that part of the code and removing it altogether.
Any other commissioner comments?
I have one question. This is Karen. I'm wondering, I thought I remembered from when the original peer support bill passed that the reason the high school equivalent was in there was in order to be able to bill Medi-Cal. So does this put that at risk? Would this put that at risk, considering our current federal administration?
We see absolutely no problem with that. And Department of Healthcare Services or any of the agencies or no one has really raised an issue. As my colleague Amir pointed out, the bill has passed through the assembly with zero opposition. And we had a conversation with the Department of Healthcare Services. They're aware of this bill and they have not raised an issue.
Well, that's great.
Thank you.
Okay, great discussion. Kendra, would you want to move into 988 or
Yes.
anything to wrap up?
Nope. We'll do the motions or the symbolic motions at the very end.
Okay.
Okay, so next we have AB 1540 by Assemblymember Gonzalez. We have Kyle Johnson, legislative assistant with their office. This bill is sponsored by Equality California, the California Alliance of Child and Family Services, and the Sacramento LGBTQIA+ Center. This bill is currently in the Assembly Health Committee, and I will introduce Kyle to present about this bill. Oops, I'm on the wrong slide. I'm sorry. There you go.
Howdy, folks. Good to connect with you all. My name is Kyle Johnson, he, him pronouns. I serve as the legislative aide and communications aide for Assemblymember Gonzalez. Very excited to be with you all today. In the room as well as Adrienne, my right-hand partner in pushing this. She's with the Alliance. And so happy to answer any questions that you folks may have. Broad strokes on this one. Top line, the bill seeks to restore the Press 3 option under 988 at the federal level. Since 2002, there was a pilot program that became semi-permanent that basically operated a subnetwork of 988 call centers that were specifically designed to support LGBTQ plus youth in crisis. From 2022 through July 2025, so 3-year period, they received 1.5 million contacts. And just prior to the cut of the system, I should say prior to the contracts ending, so the effective cut of the program, they were receiving 70,000 calls a month. That's nationwide. So the demand was extremely high, and why it was cut is still unclear. We have been in, amazing partnership with several different folks in the state, but our LA Department of Mental Health was able to generate numbers that roughly estimate that 9% of calls to the 988 Press 3 line came from California. And that is, a significant number of LGBTQ plus youth who are asking for help. And, 1.5 million contacts doesn't just happen, right? Like, our youth depended on this. So my boss, came together with, our broader coalition and said, we want to fix that. The Press 3 option will basically just be restored in California. We will reprogram the phone trees that exist in our current 988 system and broadly contract with a different entity or a specific entity that specializes in LGBTQ plus youth mental support. Funding mechanism on this one, just because I know that's going to be a question, is we are going to look at the 988 surcharge revenue. There's currently a surplus in the revenue. About the 988 system has only been spending about 27 to 35% of their annual budget for the last couple of years. So they developed a small surplus that they've already accounted for. And so hoping to tap that money. Our rough budget estimates that we have been able to generate based off of some of the raw data that we have is we would approximately need 2.5 million to ongoing to operate the contract with the subnetwork. That's based on estimated call volume or contact volume with the provider, and then some one-time spending for infrastructure upgrades, as well as staff time to program these different data trees. I'll leave it there. I want to make more time for questions because I know that this is a little complicated and technical. But yeah, happy to answer them.
Great, thank you. I'll just quickly, before questions, go over how this fits our decision-making framework for the committee. It directly addresses behavioral health and the transformation agenda, focusing on suicide prevention and crisis intervention within the 988 continuum, of which the commission is an advisory member. And this bill embodies our strategic plan's commitment to champion vision into action by elevating diverse voices and improving systems to ensure equitable access and catalyzing best practices. Most importantly, it advances equity for LGBTQIA plus youth, a group that is marginalized and underserved. And the potential impact is high, given the life or death nature of this issue for vulnerable population and the context of federal funding reductions. So consequently, the urgency of this bill is clear. As you heard, the funding mechanisms are still under development, but this is very early in the legislative process, so that's not uncommon. And lastly, it strongly aligns with our vision and has significant stakeholder support as well. Happy to open it up for questions.
And I just real quickly before we jump into questions, I do want to highlight a couple big statistics that I forgot to mention prior to this. So we do have a report from the CDC that shows that 20% of surveyed students in a control population that they did who identified as gay, lesbian, or bisexual had reported to attempt suicide in a year previous compared to 6% of their heterosexual peers. And for transgender or non-binary folks, it was 26%. SAMHSA, the Substance Abuse and Mental Health Services Administration, also ran their own report on this in a different year. I think their report was from 2023. And they found that 3.3% of young straight adults between 12 and 17 years attempted suicide. And that number jumps 3x to 10.1% for LGBT young adults in the same age range. So it's very obvious that there's a big need here. And thank you for emphasizing that point. And I'm happy to answer any questions.
Thank you for that. It looks like we do have some questions. I do want to just thank Deputy Director Zoller for keeping our disciplined matrix approach and how each bill that comes before us, we send it through that matrix to ensure that there's alignment with our commission and our strategic plan. So I appreciate that. I have some questions, but I'll first defer to Commissioner Fairweather to provide hers.
Yeah, just following up on the funding. It sounds like they were spending less than half of their budget. And so would this would the 2.5 million, would that surplus cover it? And the second part of the question is, is there competition for that funding, or sort of what's required to get that over that funding mechanism in place?
Yeah, thank you for your question, and I think you're 100% spot on this one. I apologize. There's a lot of technical pieces on this one, so I will try to explain it in the best way I can, and happy to clarify as needed. The 988 system works in a backwards kind of way in generating revenue, and so they currently put a tax on, or a fee, I should say, on all connected phone lines in California. It's a monthly tax, and current this year it is set at 8 cents. They determine the cent, they're approved up to 30 cents, I should say, and they have been locked in at 8 cents per the AB 988 that was passed several years back from Assemblymember Barra Kahan. They've been locked at 8 cents for the last through 2 or 3 years. Um, this is the first year where the fee is actually now determined by agency. It's operated by HHS and in partnership with OES. 988 has kind of dual ownership, I should say. It's kind of operated by HHS on the contracting side and 988 on the technical implementation side. And so OES basically just tells HHS how much money they need to do their part of it, and then HHS determines their contract values and reimbursement rates for call centers, basically. They currently in the fund, I'm trying to find the specific dollar amount. They are operating at, as I mentioned, 25 to 35% for the last couple of years, and it looks like their total value that they currently have in their accounts is about $26 million in surplus revenue right now. And so there is definitely a plenty of dollars that can be accessed to fund this. There are competing, I would say, interests to access this funding. I know that there's a lot of conversations specifically with the 988 call centers that we've been my boss has met with them countless times, including myself. The call centers themselves, there's 11 of them in the state, and there is a lot of outstanding debt to the call centers that OES needs to reimburse for. I don't know much specifically about that, but I do know that there is outstanding reimbursements that they're waiting for. And there's also a very large push by the call centers to increase reimbursement rates for their services. They are servicing so many calls nowadays, and the funding hasn't increased to the call centers to address that. So the call centers just at the they're called the consortium. They have an organized, body similar to this. They all just voted in unanimous support of the AB 1540 actually this week and submitted their support letter. Their president and I have a conversation on Friday as well to touch base, but they are in support, and my boss also has a commitment to support their effort to get more funding as well. So yes, and I hope that answers your questions, and I'm happy to go into more detail as necessary.
Yeah, thank you.
Other commissioners? Well, go ahead.
Oh, no, you go ahead, Mark.
Well, I just wanted to follow up. You had mentioned that nationwide there's about 70,000 per month utilizers. Do we have a sense of what it is in California?
It would be, I believe our estimates are about 9% of those contacts came from California. But that was the number that was estimated in July of 2025. And so given the additional context and roughly based on what we've been hearing from LGBTQ plus advocates in this behavioral health space, we're expecting the number to be closer to probably 11% that would potentially access this line. Obviously, like given the it's hard because given that Press 3 existed and then it was cut, it's like we don't know where those youth went. We have seen a massive increase in the overall 988 call centers volume, but the call centers don't necessarily track like the specific reason why people are calling. That's sensitive data and they don't always track all of those details. If someone automatically, when you call 988, it asks you, press 1 for veterans line, 2 for Spanish, 3 for LGBTQ. You can reasonably assume that the person pressing 3 is LGBTQ plus identifying or is dealing with some sort of LGBTQ plus crisis. And so that's kind of how we were able to generate, these numbers. When you're calling the general hotline, it's hard to track, what specifically people are calling about. Internal data from the text part of this group as well. And we have seen a massive increase in LGBTQ plus contacts specifically, because those are easier to track given the nature of the text versus the call. And we have seen like a large spike in those. I don't have a specific number for you, but we're talking in the thousands for sure.
Thank you. And just a quick follow-up. Do we need a legislative response? If I'm understanding right, HHS, the agency, can modify or make changes to the fees that could potentially gross up enough revenue to restore this. Is that just something that takes the will of the administration, or does it really need legislative legislative input?
Could you
You know what I'm
clarify your
asking?
question?
So,
Yeah,
so,
sorry.
so what I understand from your statements, that it's an 8 cent fee, a levy,
Correct.
for those
Mhm.
connected phones, and that fee is determined not by legislation but by the agency.
Correct. By need, correct.
So is that something that could be done administratively?
Yes. Yep. So great question. So the cent fee is determined backwards. So agency and OES come up with, a number. So let's say, for example, they need $50 million to operate 988 in California, for fiscal year 2026, 2027. I'm just spitballing numbers here, right?
Yeah.
They go, okay, great. Given that we have, $50 million need, we'll look at what's in our current bank account. Obviously, they always have reserves. They say, we need to raise $35 million in revenue to, make sure we stay at our current, rates. Okay, great. They ask all of the providers in California, how many connected lines do you have? That number is 47 million something in California. Um, they take that, great, and then they just do the calculation backwards. Okay, if we have it at 1 cent and it's at 47 million lines per month, do we raise $35 million a year? So that's kind of how like the math works out. It's a little bit
Okay.
of algebra, but
So,
yes,
okay, that clarifies some things for me. So basically, what you're saying is they have the mechanism to raise the funds, but they need the legislative mandate to restore this, that in order for them to then raise those funds for its
correct. So
restoration. Is that
they need the legislative action to do two things. One, authorize them to contact SAMHSA, basically, which is the federal agency, and request that they program the Press 3 lines through California. Um, and then the second part of that is that we have to authorize 988 surcharge was designed in a way with very specific intent, from Assemblymember Bauer Cahan. I completely respect the way she did this. The surcharge cannot be used to you cannot pull money out of the surcharge to fund any other projects that's unrelated to 988. As part of the negotiations that happened, specifically because obviously like it runs similar to how the 911 surcharge works on phones. Like that money can only be used for the dispatch of 911. It cannot be used for like funding police or funding emergency services or et cetera, right? So it mirrors that type of language. So we have to authorize technically, like, well, that's the debate currently I'm having, but this should be an allowable expense under it, but our bill explicitly states like this is an allowable expense using the surcharge.
Thank you. Commissioner Fairweather?
This question has nothing to do with my support for this. But can SAMHSA just say no?
That is currently that is the question of the century at the moment. Um, I have been, belovedly calling it the Trump effect.
Yeah.
I have no idea
Yeah.
what we're basically reliant on. So SAMHSA contracts with Vibrant to operate 988. Vibrant is associated with Mental Health America. Mental Health America has told us that they are supportive of this effort. Obviously, Vibrant has to listen to SAMHSA.
Yeah.
I'm not speaking on behalf of any of those orgs. I'm just saying this kind of like roughly the information I have currently. It is unclear if SAMHSA will approve this as a legislative office. I have actually been in contact with SAMHSA and they do not respond to us, and that is fine. I think they require agency to agency contact,
Hmm.
and more of like, hey, once this bill is actually put into law, we have like the legal backing saying like, hey, we have the funding, we have the technical willpower, we want to do this. Can you work with us? Um, Washington State has a Press 4 program, that I forgot to mention as well. We're
Hmm.
mirroring our efforts after Press 4. Press 4 is a Native and Indigenous hotline. And so my conversations with actually the advocate who led that effort have been extremely helpful. And we have addressed a lot of the concerns that SAMHSA gave to them as well, um, when they were trying to kind of furnish this Press 4 program. So moral of the story is we're not really sure if SAMHSA will approve it, but we're not also going to wait for Donald Trump's approval to do things. We're going
Of course,
to try
yes.
our
Makes
best
it
and
so
see what we
much.
can do.
Yeah.
Yeah,
Yeah. Thank you just for that it makes it almost, almost more important. So thank you.
of course. Thank you. And she said, the advocate for Press 4 said that the biggest aid in getting SAMHSA's approval was having advocates backing the legislation. They want to see the people on the ground that are involved in the space, that are involved with the community you're trying to support, who actually want this. That this isn't just a political stunt to get headlines, that this is something that, you know, people want to see. And that has been our approach since day one, even before I talked to the advocate. And that's why we have such a broad coalition, backing this bill. And I hope, to include you guys on that as well.
Thank you. Any other commissioner comments?
Yeah, this is Commissioner Callan. I have a question. It looks like in Colorado and Illinois and maybe Nevada, they're training the 988 counselors to on supporting LGBTQ plus
Hmm.
issues. Do you have any data on that compared to having our own be the first in the nation to have a number 3 line?
Yeah, and California actually has a similar program. The governor announced a partnership with Trevor Project. I want to say towards the end of last year, I think it was in August, that California will be contracting with Trevor to Trevor Project, apologies, to do similar trainings for our 988 counselors. And this was actually a point of, question from some of the call centers, as well as some of the advocates in the behavioral health space. And thank you for flagging it. Um, I think this is wonderful. I mean, the more people that are trained and culturally competent in addressing LGBTQ plus issues is incredible. Um, and the reality of the situation is most people that are calling in crisis may not always wait in press 3, right? They may just automatically, not be paying attention and be routed to the, general hotline. In addition, it's going to take time to implement press 3. We have to reprogram the whole tree, phone tree, which isn't a very heavy task, but it just takes time. And then we also need to do the competitive grant-based project and make sure that the entity contracted. Moral of the story is it's going to take time to implement this bill should it become law. Um, the trainings are incredible. I also caution, uh, you know, from the advocates who are the subcontracted entities that would be servicing Press 3 are specifically trained and have experience working with LGBTQ plus youth in crisis. They are not necessarily generalized counselors who are trained in normal crisis response. And when it comes to an LGBTQ plus youth specifically, and where my mind immediately goes is like a transgender or non-binary person's, uh, you know, crisis, there's no room for mistakes. There's no room for misgendering them, and there's no room for, you know, having to be unfamiliar with, what all of these LGBTQ plus related terms are, right? And so these entities that existed with the original Press 3 subcontract, um, they were specifically trained in how to respond to, gender identity and gender exploration, and sexual identity as well, which and it makes me think of like my mom, who obviously she is not a, counselor by any means, but when I came out to her, she thought I was trans because I liked boys. And I had to explain to her that boys can also like boys and girls can like girls, and being trans is gender. And, there's a difference between sexuality and orientation, right? Like those things take time, and you can't just expect a counselor, regardless of where they're placed or who they're working for, to fully understand that through, a series of trainings. It takes specialty.
Thank you. So this is a sort of a lifeline in the meantime. Yeah.
This is Lifeline in the meantime, and I think that's a great way to put it. Additionally, I always like to flag like some LGBTQ plus folks are older than youth, right? They're above 18, and they obviously also have higher suicide rates or crisis rates, and it's good for counselors in that space to be able to, be culturally competent and understand like, oh, if a person calls and it's a woman on the line and she says my girlfriend is in crisis, where they are not like, oh, do you mean your boyfriend, or things of that nature, right? Like these trainings are really good exposure for, especially like there are call centers located everywhere in California, including, Northern California, where my family live, up in Redding. That may not be as progressive as, Didi Hirsch, for example, which is located in downtown Los Angeles, right? And so, a lot of lived experiences are very different. And so, training regardless is always good. But it's a reason also to, like, we have a veterans hotline, right? Veterans call with very specific needs. PTSD is a very complicated uh, mental health crisis that you have to work through. And so those counselors are trained like such. Spanish speaking also, like Spanish culture or Hispanic or Latino cultures are very different depending on where they're from, and so addressing in a more culturally competent way can actually help support uh, crisis intervention.
All right. Very robust discussion. Thank you. Is there any other commissioner comments or questions? Okay. Hearing none, we will have Mariani open up the phone lines for public comment on both AB 96 and AB 1540. Mariani?
We've got one more item before public
Oh,
comment.
I'm sorry. I missed it. Go for it.
Okay, one more to go. This one is not a bill. This is a budget proposal, but it's in the governor's proposed budget that he released in January. So something a little bit different for our committee, but it's still in the legislature and part of that process. Our state is at risk of losing a critical life-saving mobile crisis intervention services for hundreds of thousands of Californians due to this proposed change. Released January 15th, it would shift costs for these essential services from the federal government onto our counties. This threatens the very existence of these services, particularly for rural and underserved communities across California. This change is driven by the expiration of the enhanced federal Medicaid matching rate at the end of 2026 and the federal administration's decision to let this funding expire is crippling the state's abilities to sustain these vital services. Mobile crisis teams, the Commission's done a lot of work in this area. They're a cornerstone of the behavioral health system. They're designed to ensure people experiencing behavioral health crises are met by the right responders at the right time in the right setting. These teams are highly effective. They divert individuals from jails and emergency departments and connect them to appropriate care. This is a model that works. As we found, we at the Commission supported a lot of these teams through our Mental Health Wellness Act grants, then called Triage. Importantly, while established for Medi-Cal members, these teams serve everyone regardless of insurance status. So as of December 2024, 48 counties are approved, covering 98% of Medi-Cal members statewide. But as I mentioned, they serve everyone, so this reach extends beyond Medi-Cal. If this proposal is adopted, counties will have to absorb significant new costs. For example, the Los Angeles Department of Mental Health estimates an annual cost increase of approximately 8.5 million, and this is before accounting for potential increases in service levels. A very rough early estimate for the whole state would be about 130 million, according to CBHDA. That's not a state number or reviewed number, just very rough estimate. And also according to CBHDA, this cost shift comes at a time when counties are already experiencing significant fiscal strain and are tasked, obviously, with implementing a lot of new initiatives, including Behavioral Health Services Act. The additional burden will force many counties into more painful decisions and potentially scaling back or eliminating these benefits, as it will be optional and not mandated. This is particularly consequential, as you've heard about. We're actively implementing a comprehensive crisis response framework under AB 988, and mobile crisis response is a huge component. So this proposal would have a significant effect on that, and risks rolling back the millions already invested by the state and counties in building this statewide benefit, potentially leaving vulnerable individuals without access to essential community-based crisis response. We've been asked by CBHDA and others to oppose this cut and strongly urge policymakers to maintain and extend mobile crisis intervention as a statewide mandatory Medi-Cal benefit. This will ensure equitable access to behavioral health crisis services across the state, preserve the significant investments already made in planning and rolling this out over the past, 5 years, and protect the millions of Californians who depend on these life-saving services. I believe we have CBHDA on the line in case there's technical questions. I think they're still on. Basically, if the commission were to oppose this cut, we would write a letter and work in the budget committees through May revise and potentially down to the June signing of the budget to hope that it's not in there. Of course, that means it's competing with other things that we don't necessarily know about yet. So happy to answer any questions, especially with our CBHDA on the line. And feel free to add anything, Amir, if I missed anything.
I think you covered it really well, but definitely happy to answer any technical questions if there are any.
I have a comment more than a question. This is Karen Larson. In my day job, we were sponsors of AB 988, and we had a lot of co-sponsors, some of whom are on today. And the vision was to have somebody to call, somebody to come, and somewhere to go. And we're really worried that if this goes forward, there's not going to be anybody to come in the majority of California's counties. And so I understand that we're in a horrible budget situation, and feel strongly that this is in line with all of the commission's priorities, and losing mobile crisis means losing people's lives.
Any other commissioner comments?
Merely that this is a really crucial service that needs to be preserved.
Agreed.
I agree. Okay, I can, if you bring back up the PowerPoint, we can go through the motions if we're ready for that. Oh, we have public comment. I'm sorry. Now it's time.
Thank you. Thank you for keeping me on track. Mariani, are we, a quick question, Mariani, are we taking public comment on each individual item or collectively, the three items?
Yes, folks can feel free to comment on any of the three bills.
Okay, thank you.
Three items. We currently have one in-person comment from Danny.
Good afternoon. My name is Danny Therical, Public Policy Coordinator with Mental Health America of California, also speaking on behalf of the California Youth Empowerment Network. Just wanted to share our support for the two bills, AB 96 and AB 1540. So we would urge the Commission and this committee to support those bills moving forward. We also wanted to share our concerns and opposition to the proposed budget regarding the Medi-Cal mobile crisis benefit. And so we would also urge this commission to oppose that change in the budget. And then lastly, just would like to quickly plug that we are co-sponsoring with the Alliance for Child and Family Services, AB 1626 by Assemblymember Gabriel, which would require mental health training for high school coaches. So we would invite any organizations listening and this commission to support that bill moving forward. Thank you.
Thank you. And we have 3 virtual comments. Our first comment is from Tara. Your line is open.
Great, thank you. Good afternoon, Tara Gamboa Eastman with the Steinberg Institute. What a great discussion on all 3 of these items. I think it highlights what important issues are coming before the legislature this year. And I'm happy to share that the Steinberg Institute is in support of AB 96 and also supports the opposition of the potential shift of the state mobile crisis team benefit to an optional benefit. On AB 1540, I think what a tremendous loss of the Press 3 option. It was horrifying to see that specific benefit and program was cut during Pride Month last year. I think that sent a clear message that the intention was to instigate fear and make people feel alone and isolated. And that is not what California stands for, not what the Commission stands for, and it's certainly not the intent of the 988 system. I think as sponsors of the original AB 988, we have technical concerns regarding the implementability of AB 1540 as currently written, with particular concern for the long-term funding and sustainability on that front. But look forward to working with the author and sponsors to make sure that it works and that we don't risk further weakening services for LGBTQ youth in California. Thank you.
Thank you. Our next comment is from Carly.
Thank you. Good afternoon, Commissioners. Carly Stelzer on behalf of the California Behavioral Health Association. Want to just echo the Commissioner Larson's comments around mobile crisis benefits. CBHA is also really concerned around the governor's proposal to make those optional to counties, and we would encourage the Commission to express their opposition to that change as well. We also wanted to share our support for AB 96. We would encourage the Commission to support that measure as well. And I also wanted to just express my appreciation to the author's office and sponsors of AB 1540. CBHA represents a quarter of the 988 call centers. We've also expressed some concerns about the implementability of 1540 and some of the changes to the rates and funding streams. And so we really appreciate working closely with the author's office on amendments there that will better support 988 call centers. We appreciate the Commission for hearing all of these really important issues and being thoughtful in your approach that you take. Thank you so much.
Thank you. Our next comment is from Steve.
Hello, my name's Steve McNally. Again, I'm from Orange County, speaking as an individual. I may get a call from a doctor, so I'm just going to have to stop at that point. But there's nothing to be against on AB 96, but I do wish that we would have gotten maybe some more additional information. For example, currently we have, if you go to the dashboards at Cal Mesa, you can see by name, by county, each certified peer that exists in the state, but you can't contact them. But you can see 7,800 of them. So my question would be, of the counties, how many of the 7,800 in each county are actually currently billing? Or CBHDA could help us with that. Also, what are we planning to hire a lot more than 7,800? And I'm still very concerned about not billing and managed healthcare, regardless of giving the peers having a pathway there. There may be differences. It'd be nice to see the curriculum because now peers are going to have to be dual certified. And in that's not necessarily a problem in Los Angeles because their peers were called community health workers. So they are handling enhanced care management, which is a critical component, and mobile crisis response. That also is a big component to use certified peers. And if you look at the state awards a couple of years ago, you can see exactly by county how much they got in the mobile crisis response. And unfortunately, the state can't pick up what the increased match that's the decreased match from the federal government. But that is one, as one of your commissioners said, it's a critical element, but it's also critical because it's the one element that everyone sees in the community, whether you're in the county mental health plan or not. So I'm not necessarily against it, but it's also unfortunate that whoever is against it cannot show themselves for some particular reason. And that's always been a problem for me as a community member. How much is done in back rooms, lack of transparency, and unless an organization actually shares their letters to the Department of Healthcare Services with us, we will never know who represents what or not as they're going through the amendment process. So I'm not against it. I gave Corey Jackson, Assemblymember Jackson, a fan club in 92627 when I saw him in December at a adolescent and child psychiatry event, but then it got totally gutted in currently. So you can compare it when you look at the bill. And I apologize, I'm going to have to go, but thanks for letting me have my say. I'm not against it. I'm just disappointed that peers don't have a way to get into the bigger managed healthcare funding and makes those jobs less valuable. Thank you.
Thanks. And then our last public comment is from Laurel.
Good afternoon. This is Laurel Ben Hamida with Mass Social Services Foundation and ROMCO, the Reducing Mental Health Disparities Coalition. Well, it's hard not to be frustrated and sad about the situation of peers in California right now. I hope that we can get to a better place. It's, lived experience isn't a fun experience necessarily. You may learn from it. You may be able to frame it in a positive way at some point, but more hits aren't good for people. And it is an evidence-based practice. So I don't know why it is not more respected and has been not treated with more respect in the writing of Prop 1. I want to thank you for your courage in pushing back against hate with regard to the LGBTQ option. And I think that's where California needs to step up, and I'm glad to see the commission stepping up. And I guess I would just add that Mass SSF stands for Muslim American Society Social Services Foundation. We have had the Amala Hope Line, which is a peer-run youth hope line, which will take calls from anybody, but has been focused on Muslim youth, and most of the youth, if not all, who've volunteered to be on it, have really dedicated a lot of time for almost just stipends over the years. It was started in Sacramento and Stockton area. And a motivated young person decided to start it. And now it's really put that plug in, or that good memory. Thank you. Bye-bye for today.
Thank you, Laurel. And then that was our last public comment.
Okay, now that public comment has closed, we can entertain a motion. We'll take them one at a time. I don't know if we're going to put them up on the screen or not. Okay. So the motion is that the Legislative and External Affairs Advisory Committee recommends that the full commission support AB 96 and directs staff to communicate its position to the legislature and to the governor. Can I get a motion?
So moved.
Fairweather moves.
Mitchell
Second.
made the motion and Fairweather seconded. Sorry, Mitchell did speak first in person. This is very difficult with the virtual versus not.
Okay.
Thank you. Commissioner Fairweather.
Aye.
Commissioner Hill, marking absent. Commissioner Larson.
Aye.
Commissioner Mitchell. Commissioner Southard. Commissioner Southard. Marking absent. Commissioner Thomas Beckett. Marking absent. Committee Vice Chair Cowan.
Yes.
Committee Chair Bontrager.
Aye.
And Southard is an aye.
Okay, thank you. 6 in total, the motion passes.
All right, thank you. All right. Second motion, AB 1540, that the Legislative and External Affairs Advisory Committee recommends that the full commission support AB 1540 and directs staff to communicate its position to the legislature and to the governor. Do I have a motion?
So moved.
Southard moves.
All right.
Second.
Southern made the motion and Mitchell seconded. Sorry, apologies, Fairweather.
No problem.
Commissioner.
I know I can depend on my fellow commissioners.
Yes. And for your vote, Fairweather. Is that an aye?
Yes, it's an aye.
Commissioner Hill, marking absent. Commissioner Larson.
Abstain.
Commissioner Mitchell. Commissioner Southard.
Aye.
Commissioner Thomas Beckett, marking absent. Committee Vice Chair Cowan.
Aye.
And Committee Chair Bontrager.
Aye.
5 in total, the motion passes.
All right, motion 3. The mobile crisis budget item, the Legislative External Affairs Advisory Committee recommends that the full commission oppose the proposed change to the Medi-Cal community-based mobile crisis intervention service benefit included in the governor's 2026-27 January budget and directs staff to communicate its position to the legislature and to the governor. Do we have a motion?
I'll make a motion.
Second.
I'll second.
All right, noting that Larson made the motion and Cowan seconded. Commissioner Fairweather.
Aye.
Commissioner Hill, marking absent. Commissioner Larson.
Aye.
Commissioner Mitchell. Commissioner Southard.
Aye.
Commissioner Thomas Beckett, marking absent. Committee Vice Chair Cowan.
Aye.
And Committee Chair Bontrager.
Aye.
And the motion passes.
All right. Thank you for that robust discussion. Are we ready for agenda item 6? I just want to ensure that I'm on track. If we are, I can't see it because we still have the motion up on my screen. Okay. All right. Agenda item 6. This item includes an update on the early psychosis intervention video. When the commission launched their EPI Plus grants, part of the funding was for promotion and outreach. Commission staff have been working on a video to promote coordinated specialty care and help elevate that recovery is possible. I'd like to invite Chief of Communications, Andrea Anderson, to present on the progress made thus far. Andrea.
Thank you, Chair. Hello, Commissioners, everyone. I'm here today to talk about a project that we are working on at staff level, and we're just excited about it. It's no motions today, just an information piece, just to kind of bring you guys along so that when we do get to the point of getting ready to release it and moving forward a little more, that you'll have some background on the work. So just informational today. Let's see. First of all, we just want to talk through, and I'm going to have to make sure I'm doing this right. Hang on. Yep, there we go. The psychosis landscape, just a couple of brief outlines to sort of place ourselves within, what we're talking about as far as the video's content. Each year, nearly 21,000 Californians experience their first episode of psychosis, putting them at significant risk for health challenges, higher mortality rates, housing insecurity, incarceration, and more, all because of untreated symptoms. The economic burden of schizophrenia in the U.S. is estimated to be $340 billion. One thing that we talk about is that despite the perception, psychosis is actually not a death sentence. We want to be sensitive to folks that have lost their lives in first episode psychosis, but generally speaking, that is a message that is really important to get out there. People can thrive after the onset of symptoms when they receive care that meets their needs. So the Commission's work on psychosis, I just wanted to give you a quick overview of that. We administer a grant called Early Psychosis Intervention Plus, or EPI Plus, as we call it. This helps counties start or scale their coordinated specialty care through a hub and spoke model. Funding for the video project that we're talking about today comes from this source. We worked with McKinsey, consulting firm, to develop a strategic plan for early psychosis in California, laying out the possibilities of scaling services to meet need. We also partnered with Kaiser Permanente for a small pilot study comparing CSC and non-CSC treatment, and found that while symptoms were stable through the 24-month study period for both patient cohorts, costs of care, both emergency departments and therapy, dropped for patients enrolled in CSC. So it is an evidence-based practice. The problem statement that we are trying to address in our video is that there exists, I should say, a proven evidence-based solution for successfully treating early psychosis. The solutions exist, they save lives and money, but are not scaled to meet current demands of Californians living with serious mental illness. Psychosis is not broadly understood, and its treatments are neither well known, understood, nor financed. So that's kind of the crux of what we're looking at as we consider our options for this this tool. And so the tool itself, which is a video, is a short, approximately 4-minute explainer video illustrating the components of CSC and focusing on showcasing their efficacy in treating early psychosis and preventing the negative impacts of severe mental illness. Through short video clips, we will weave in a personal story of how this model positively impacts those who have experienced it. This approach will help us maintain our primary project objective to be informative, while also allowing us to share the stage with community voices, which helps support our goal of inspiring viewers to take action in creating demand for investing in and bringing CSC to scale in California. So just to kind of summarize, the project goal here, the primary project goal is to inspire communities and leaders to create demand for investing in CSC and expanding its reach across California. We have a couple secondary goals as well, and kind of been the crux of my work since I've been with the commission now for a long time here from a communications perspective is just another way to help overcome the stigma of psychosis and all serious mental illness that shuts down conversations about it. Plainly lay out why investment in early psychosis intervention, especially CSC, is so strongly needed, and generate a desire in viewers to advocate for this straightforward solution. So we're hoping those conversations, this video would inspire those types of conversations that instead of, the people on the street, there's no hope for them, that there is actually a solution. We are in the process of designing the video to feature Dr. Tara Needham. Many of you are familiar with her work, and she's spoken in front of the commission many times. She's with the UC Davis EpiCal program. She will be the voice of opportunity through a provider lens. The video is also being designed to feature the voice of a person with lived experience with psychosis and participating in a CSC. We're targeting the release of the video by mid-2026, with funding for the work expiring in June of 2026. We're still in the process of recruiting for a voice of lived experience with CSC through CSC programs throughout California, as well as advocacy organizations that the Commission works with. We are welcoming referrals for anyone interested in participating in the program as a voice of lived experience with CSC. So please definitely reach out to us if you know of anyone, if you know of any programs that you think might have participants that would be willing to be featured in the video. We're definitely on the hunt there. So, all right, just talking about the release and the way that we intend to use the video. We will activate our partner network. We'll share with advocacy grantees and EpiCal to share with their own networks. We plan to share on all our digital channels, including social media accounts. We're also going to get, as part of our contract, 2 cut downs or 60-second versions of the video, which will be more appropriate for social media to just encourage that sharing even more. We'll obviously publish it on our website, include it on the Epi page, and we'll use the video in commission meetings and as part of information packets ahead of meetings with decision makers. So hopefully I did that quickly. But any questions? Absolutely. Of course. Mm-hmm.
We're unable to hear the question online.
Oh, so sorry.
Sorry, I just love the idea. So just as a suggestion, since, we don't really understand what psychosis looks like if you never experienced it or seen it. So I would just love to see these different faces coming across this educational video showing what it looks like, because it could be a little bit of anyone and anything. So I applaud that creative idea.
Absolutely, thank you. And I think that I love that idea as well. We were hoping to recruit, just 1 or 2 voices, but I think, to your point, showing a lot of different faces so that we have the opportunity for many people to see themselves, right, to recognize themselves in these multiple faces is a
and
great
different
approach.
Ages, because it
absolutely
it's not just
it's not
one different homogeneous thing.
Absolutely. No, thank you for that feedback, Commissioner. Appreciate it. Any other questions? Awesome. Thanks for letting us present, and we'll keep you updated as progress moves forward. And again, definitely reach out if you guys have any suggestions otherwise, or ideas for voices of lived experience too. Thank you.
Thank you. All right, Mariani, I think we have room for public comment on this matter.
We do. We currently have 1 public comment from Laurel. You go ahead.
Good afternoon again. This is great. I hope you will have it available with speakers of languages other than English, maybe use subtitles. MassSSF has a YouTube channel. We've done videos on domestic violence, COVID, and other subjects in different languages with speakers. It might give you some ideas about how to go about that, and widen the distribution and the ways in which your video can be helpful. Thank you.
Great idea.
Thank you, Laurel. That was our last public comment.
Are there any further commissioner comments? Okay, seeing none. We're to the wrap-up section of the agenda, to my knowledge. I do want to first apologize for not being there in person, and I want to thank everyone for keeping me on task. It's difficult from afar. My apologies for poor facilitation today, but I'll be in person next time. So in the end, I just want to say thank you to our commissioners, to the public, and to our staff in particular for being with us today, for really lifting up these issues and sharing in a very, I think, meaningful discussion with the public and our commission around these legislative matters. Our next committee meeting is scheduled for late April. We hope to see you all there. And with that, this meeting is officially adjourned. Thank you.